as is always true in pediatrics, we borrow. And so a number of the new medications that have been approved since in the past few years, so which most of what you're speaking of are essentially medications that are targeting CGRP, which is calcitonin gene-related peptide, also one of the ditans, and then a number of devices. Generally speaking, the trials for the medications, at least, are still very much ongoing in pediatrics. And so we do not yet have full data on safety and efficacy in adolescents. But as is the case, sometimes, particularly for our more severely affected teenagers, they are not eligible for the trials anyway, and they have often failed a huge number of treatments. So now that these are available, we're often borrowing off label. Back in 2018, our headache section wrote a paper essentially saying, in whom would you use these medications if you needed to? And then following that, we did essentially just a couple of sites got together and did a case series of when did we use them. There's a little bit of information. We're currently working on things like that for the GPANs, which is the oral versions. So it's little inklings of information. The devices, actually, it's a slightly different process. And so the rules for approval from the FDA for devices are different from medications. And so actually a number of the devices now have approval for adolescents, even though there were not, for most of the devices were not formal trials done. So in those cases where we are using those devices, theoretically on label, but realistically, again, not with a whole lot much more evidence, quite frankly, at this point.